Hey, what's up, guys? Welcome back to Humana Insurance video tutorial series. And in today's video tutorial of Humana Medicaid 4.3, we are going to talk about three important, crucial topics. And those are number one, accessing support and resources. Number two, renewing coverage. And number three, common frequently asked questions and troubleshooting. So before we get started with this video tutorial, I will suggest you to watch Humana Medicaid video tutorial 4.1, 4.2 first, and then continue watching this video. All right. So without taking much time, let's get started. So in our previous two video tutorials on Humana Medicaid 4.1 and 4.2, we have covered 7 topics, right? So now there are 3 topics, 8, 9 and 10 we are going to cover in this 4.3 video tutorial on Humana Medicaid. All right, so let's start from topic 8, accessing support and resources. Now, we are going to cover here 3 points under accessing support and resources. And those are various support services available to Humana Medicaid members, such as customer service, case management, and online resources. And after that, how to access online portals and mobile apps for managing health benefits. And after that, we'll cover information on how to reach out for help with specific issues or questions. So, various support services available to Humana Medicaid members, such as customer service, case management, and online resources. So Humana Medicaid members have access to a variety of support services designed to help them navigate their healthcare, manage their conditions, and understand their benefits. Here is a detailed overview of the support services available. Number 1, customer service, guys. 24/7 support line. Humana provides a customer service line that is available 24/7 to assist with any questions or issues related to your Medicaid plan. This includes help with understanding benefits, finding providers, and resolving billing issues. Multilingual support. For non-English speakers, customer service is available in multiple languages to ensure clear communication and understanding. Number 2, case management. Personalized case managers. Humana offers personalized case management service for members with chronic conditions, complex health needs, or those requiring extensive medical care. Case managers help coordinate care, ensure access to necessary services, and provide support in managing health conditions. Care coordination. This service involves coordinating between different healthcare providers and services to ensure that members receive comprehensive and continuous care, guys. Number 3, health and wellness programs. Disease management programs. Programs specifically designed for chronic diseases such as diabetes, asthma, heart disease, and more. These programs provide education, resources, and support to help manage conditions effectively. Preventive care programs. These includes programs aimed at promoting healthy living and preventing illness through regular screenings, vaccination, and wellness checkups, guys. Number 4, online resources and tools. My Humana portal, an online portal where members can access their health plans information, track claims, view benefits, find providers, and much more. It also includes tools for managing health records and setting health goals. Mobile app. Humana's mobile app offers on-the-go access to your health information,
including digital ID cards, provider search, and claims tracking, guys. Now, educational resources. Online resources including articles, videos, and webinars on various health topics, conditions, and preventive care. Number 5, pharmacy and prescription services. Mail order pharmacy. For convenience, Humana offers a mail order pharmacy services where members can have their prescriptions delivered to their home. Prescription drug information. Access to a formulary, drug pricing tools, and assistance with understanding medications coverage and costs. Number 6, behavioral health services. Mental health support. Access to mental health professionals, counseling services, and support for conditions such as depression, anxiety, and substance abuse. Behavioral health programs. Programs designed to support mental and emotional well-being including therapy and crisis intervention services. I will repeat it again. Behavioral health programs. Programs designed to support mental and emotional well-being, including therapy and crisis intervention services, guys. Number 7, transportation services. Non-emergency medical transportation for members who need assistance getting to and from medical appointments. Humana often provides transportation services to ensure they can access necessary care. Number 8, member assistance programs. Community resource Community resources, assistance in connecting with local community resources for additional support such as food assistance, housing support, and financial aid. Social services support. Help with help with accessing social services that can provide additional support for daily living needs, guys. Number 9, special programs and services. Healthy reward programs, incentive programs that reward members for taking steps to improve their health, such as completing wellness activities and preventive screenings. Telehealth services, access to virtual healthcare visits with doctors and specialists, which can be a convenient and cost effective alternative to in person visits. Number 10, grievance and appeal support. Assistance with appeals, support from members who need to file an appeal or grievance regarding their healthcare services or coverage decision. Guidance is provided on the process and how to submit necessary documentation. By leveraging these support services, Humana Medicaid members can better manage their health, make informed decisions, and ensure they receive the care they need. These services are designed to provide comprehensive support and enhance the overall healthcare experience. Now, how to access online portal and mobile app for managing health benefits, guys. Accessing online portals and mobile apps for managing health benefit with Humana is straightforward and provides a convenient way to handle your healthcare needs, guys. Here is a step-by-step guide to getting started. Accessing the My Humana online portal. Number 1, visit the website. Open your web browser and go to Humana website at www.humana.com. Number 2, create an account. If you don't already have an account, click on the sign in button at the top right corner of the page. Then select Register Now or Get Started under the Don't Have an Account section. Follow the prompt to enter your personal information, including your Humana member ID, date of birth, and other required details. Create a username and password. Ensure your password is strong and secure. Number 3. Sign in. After creating your account, return to sign in page, then enter your username and password and then log in. Number 4. Navigate the portal. Once you logged in, you can access various features such as viewing your health benefits, checking claims, finding providers, managing prescriptions, and more. Use the navigation menu to explore different sections of the portal like My Coverage, Claims and Spending, and Pharmacy. Accessing the My Humana mobile app, guys. Number 1. Download the app. For iOS Apple device, open the App Store on your iPhone or iPad and search for My Humana. Tap Get to download and install the app. Okay. For Android device, open the Google Play Store on your smartphone or tablet and search for My Humana. Tab Install to download and install the app. Number 2, create an account or sign in. Open the app after installation. If you already have a My Humana account, enter your username and password to log in. If you don't have an account, follow the prompts to create one directly in the app. You will need your Humana member ID and other personal information, guys. Now, number 3, use the app. Once logged in, you can use the app to manage your health benefits on the go features, including viewing your iCard, checking claims and coverage, finding in network providers, managing prescriptions, and accessing wellness resources, guys. The app interface is user friendly with the tabs and icons to help you navigate easily. How to access online portals and mobile apps for managing health benefits. Here are tips for using the online portal and mobile app. Keep your information secure. Always log out of your account when finished, especially if you are using a shared or public device. Update your information. Ensure your personal information such as address and contact details is up to date to receive important notifications. Explore features. Take some time to explore all the features available in the portal and app to maximize their benefits. For example, set up notifications for claims updates or prescriptions refills. Technical support. If you encounter any issues while using the portal or app, Humana's customer service can provide technical assistance. By using the My Humana online portal and mobile app, you can easily manage your healthcare benefits, guys. Access important health information and stay on the top of your medical needs from anywhere at any time. Now, information on how to reach out for help with specific issues or questions. If you have specific issues or questions related to your Humana health plan, there are several ways to reach out for help and support. Here are the main avenues for getting assistance. Number 1, customer service. Phone, you can reach Humana's customer service by calling the phone number listed on your Humana member ID card or on the Humana website. The number is usually toll free. Hours. Customer service representatives are typically available during regular business hours, but some plans may offer 24/7 support. Services. Customer service can assist with a wide range of issues, including understanding your benefits, finding providers, checking claim status, and resolving billing inquiries. Number two, online portal and mobile app. My Humana portal. Use the online portal to access self-services option such as viewing benefits, checking claims, finding providers, and managing prescriptions. My Humana mobile app. The mobile app provides similar functionalities to the online portals, allowing you to manage your health benefits on the go. Number three, case management. Personalized support. If you have complex health needs or chronic conditions, you may have access to personalized case management services through Humana. Contact your case manager directly for assistance with care coordination and support. Number four, provider network. In network providers. If you have questions about finding an in network provider or specialist, you can contact Humana for assistance. They can help you locate providers in your area who accept your Humana health plan. Number five, appeal your appeals and grievance. Appeal process. If you disagree with a coverage decision or need to appeal a claim denial, Humana can provide guidance on the appeals process and assist you in submitting an appeal. Grievances. If you have complaints and grievances about your Humana plan or the care you have received, you can contact Humana to file a grievance and seek resolution. Number six, pharmacy services. Prescriptions assistance. For questions about prescription coverage, formulary, or pharmacy benefits, you can contact Humana's Pharmacy Services Department for assistance. Mail order pharmacy. If you use Humana's mail order pharmacy services, you can reach out for help with prescription refills, delivery status, and other inquiries. Number seven, member assistance programs. Community resources. Humana may offer member assistance programs that provide access to additional support services such as community resources for food assistance, housing support, and financial aid. Now, number eight, telehealth services, virtual visits. If your plan includes telehealth services, you can virtual visits to consult with healthcare providers remotely for non-emergency medical issues. Number nine, social media and online communities. Social media channels. Some health insurance providers, including Humana, may offer customer support through social media platforms. Check Humana's official social media accounts for assistance. Online forums. Participating in online forums and communities related to healthcare and insurance may also provide helpful insights and support from fellow members. Now, information on how to reach out for help with specific issues or questions. So, here are tips for reaching out for help. Have information ready. When contacting Humana for assistance, have your member ID, plan details, and any relevant documents or information available. Be clear and specific. Clearly explain your issue or questions to the customer service representative or support staff, providing as much detail as possible. Take notes. Take notes during your conversations with Humana representative, including name, date, and reference numbers for future references. Follow up. If your issue isn't resolved immediately, follow up with Humana as needed until you reach a satisfactory resolution. By utilizing these channels and tips, you can effectively reach out for help with specific issues or questions related to your Humana health plan and receive the support you need. Now, number 8, renewing coverage. Now, we are going to cover this topic, renewing coverage. Let's start with process for renewing Medicaid coverage with Humana. Renewing Medicaid coverage with Humana involves several steps to ensure your benefits continue without interruption. Here is a general outline of the process. Number 1, review eligibility requirements. Ensure you still meet the eligibility criteria for Medicaid in your state, as requirements can vary. This typically involves income limits, residency status, and other factors. Number 2, receive renewal notice. State, States generally send out renewal notice before your Medicaid coverage expires. This notice will detail the information needed and the steps to take. Number 3, gather required documentation. Collect any necessary documents such as proof of income, residency, and other relevant personal information. Common documents include pay stubs, tax returns, utility bills, and identification. Now, number 4, complete renewal application. Fill out the renewal application form. This can often be done online through your state's Medicaid portal, by mail, or in person at your local Medicaid office. Ensure all sections are completed accurately to avoid delays. Number 5, submit the application. Submit the completed application along with any required documentation. If submitting online, ensure you get a confirmation of receipt. If by mail, consider sending it with tracking to verify delivery. Number 6, verification process. The Medicaid office will review your application and verify the information provided. They may contact you for additional information or clarification. Number 7, renewal confirmation. Once your application is approved, you will receive a renewal confirmation notice. This will outline the new coverage period and any changes to your benefits or premiums. Number 8, contact Humana. After your Medicaid renewal is approved, contact Humana to ensure they have updated information and that your coverage continues seamlessly. You may need to provide them with your new Medicaid approval details. Number 9, update information regularly. Keep your contact and income information updated with both your state Medicaid office and Humana to avoid future issues with coverage. Process for renewing Medicaid coverage with Humana. Here are the specific steps with Humana. All right. Number one, visit Humana's website. Go to Humana's Medicaid renewal page or member portal. They often have specific instructions and resources to guide you through the process. Number two, Humana customer service. If you have any questions or need assistance, contact Humana's customer services. They can provide detailed instructions and support specific to your situation. Utilize resources. Number three, utilize resources. Humana may offer additional resources such as frequently asked questions, renewal checklists, and online support to assist you through the renewal process. By following these steps and staying proactive, you can ensure your Medicaid coverage with Humana is renewed without any gaps in your healthcare services, guys. Now, importance of keeping track of renewal dates and submitting necessary documentation on time. Keeping track of renewal dates and submitting the necessary documentation on time is crucial when maintaining your Medicaid coverage with Humana. Here is why it's important. Continuous coverage. Avoiding coverage gaps. Timely renewal ensures there are no gaps in your healthcare coverage. If you miss the renewal deadline, your coverage could be temporarily suspended, leaving you without access to necessary medical services and prescriptions. Access to care. Continuity in your Medicaid coverage ensures uninterrupted access to doctors, specialists, and treatments that you may require. Financial stability. Avoiding out of pocket expenses. Financial stability, avoiding out of pocket expenses. Without Medicaid coverage, you might have to pay out of pocket for medical expenses, which can be financially burdensome. Maintaining benefits. Maintaining benefits. Medicaid often covers additional benefits such as dental, vision, and transportation services, which can be expensive if you lose coverage, guys. Now, compliance and eligibility. Meeting state requirements. Each state has specific eligibility criteria for Medicaid. Keeping track of renewal dates and submitting documentation ensures you comply with these requirements and continue to qualify for benefits. Verification process. The renewal process typically involves verifying your income, residency, and other personal information. Timely submission helps avoid any issues or discrepancies that could affect your eligibility, guys. Administrative efficiency. Simplifying the process, submitting renewal documentation on time can streamline the administrative process, making it easier for Medicaid and Humana to process your renewal without delays. Preventive overlaps and errors. Timely renewals reduce the risk of administrative errors, overlaps in coverage, periods, and miscommunication between you, Medicare, and Humana. Health management. Importance of keeping track of renewal dates and submitting necessary documents on time. Here we are on this topic, health management. Managing chronic conditions. For individuals with chronic health conditions, continuous Medicaid coverage is vital for regular monitoring, medications, and treatment. Preventive care. Consistent coverage ensures you have access to preventive care services which can help detect and manage health issues early, avoiding more serious health problems later. Legal regulatory compliances. Adhering to legal requirements, failing to renew on time can result in non-compliance with state and federal regulations governing Medicaid. Avoiding penalties. In some cases, there may be penalties or waiting periods for re-enrollment if you miss the renewal deadlines. Now, importance of keeping track of renewal dates and submitting necessary documentation on time. Practical tips for keeping track. Number one, adhering to legal requirements. Failing to renew on time can result in non-set reminders. Use a calendar or digital reminders to alert you about upcoming renewal dates. Number two, organize documents. Keep all necessary documents in a designated folder so they are readily accessible when it's time to renew. Number three, stay informed. Regularly check communications from Medicaid and Humana for any updates or changes in renewal process. Number four, contact customer service. If you are unsure about any part of the renewal process, don't hesitate to contact Humana's customer service for guidance. By staying proactive and organized, you can ensure that your Medicaid coverage with Humana remains active and uninterrupted, allowing you to focus on your health and well being without additional stress or financial strain. Tips for maintaining eligibility and avoiding coverage lapses. Maintaining eligibility and avoiding coverage lapses for Medicaid coverage with Humana requires proactive planning and consistent management of your application and documentation. Here are some practical tips to help you stay on the top of your Medicaid benefits. Number one, understand eligibility requirements, income limits. Know the income limits for Medicaid in your state and ensure your earnings stay within these limits. Report any changes in income promptly. Residency. Maintain proof of residency, such as utility bills or lease agreements, to verify that you live in the state where you are applying for Medicaid. Other criteria. Be aware of other eligibility criteria such as age, disability status, family size, and pregnancy status. Number two, keep track of renewal dates. Calendar reminders. Mark renewal dates on a calendar and set digital reminders a few months in advance. Notification. Sign up for email and text notification from your state Medicaid office or Humana if available. Number three, gather necessary documentation. Income proof. Collect recent pay stubs, tax return, and other proof of income. Residency proof. Keep documents such as utility bill, lease agreements, or mortgage statements. Personal information. Have identification documents like social security card and birth certificates ready. Number four, complete renewal applications promptly. Early submission. Aim to submit renewal applications well before the deadline to allow time for any issues that might arise. Double check information. Ensure all information is accurate and complete before submitting to avoid processing delays. Number 5, report changes immediately, guys. Income changes. Report any changes in income as soon as they occur to avoid complications. Household changes. Notify Medicaid of any changes in household size, address, or other relevant details. Number 6, stay in contact with Medicaid and Humana. Regular updates. Regularly check for communication from Medicaid and Humana regarding your coverage status and any required actions. Customer service. Use customer service for assistance with any questions or concerns about your eligibility or renewal process. Number 7, utilize online tools and resources. Online portals. Use state Medicaid portals and Humana's member portal to manage your account, submit documents, and check the status of your application. Educational resources. Take advantage of online guides, frequently asked questions, and renewal checklists provided by Medicaid and Humana. Number 8, keep records organized. Document storage. Maintain any organized file, physical or digital, with all relevant documents and correspondence. Tracking submissions. Keep copies of all submitted forms and any confirmation receipt. Number 9, seek assistance if needed. Navigators and counselors. Utilize Medicaid navigators or insurance counselors for help with understanding eligibility requirements and the renewal process. Community resources. Contact local health clinics, community organizations, or legal aid services for additional support and resources. Number 10, regular reviews. Periodic check-ins. Regularly review your financial and personal situation to ensure ongoing eligibility. Adjustment. Make any necessary adjustments to your budget or documentation practice to maintain eligibility. By following these tips and staying proactive, you can help ensure that you maintain your Medicaid eligibility and avoid lapses in coverage. Consistent management and prompt communication with Medicaid and Humana are key to ensuring continuous access to the healthcare service you need. So guys, now we'll understand topic number 10, common frequently asked questions and troubleshooting. Okay, we'll understand frequently asked questions about Humana Medicaid, solutions to common issues that members might encounter, such as denied claims or difficulty finding providers. Contact Humana or their state Medicaid office for unresolved issues. So we are going to understand these topics one by one. All right. So let's start with frequently asked questions about Humana Medicaid. Here are some frequently asked questions about Humana Medicaid, along with detailed answer to help you understand your benefits and responsibilities. Number 1, what is Humana Medicaid? Humana Medicaid is a managed care plan offered by Humana, providing health insurance coverage to eligible Medicaid beneficiaries. It includes a range of healthcare services such as doctor visits, hospital care, prescription drugs, and preventive care. I hope you got the answer to your question. Let's move to question number 2. How do I know if I am eligible for Humana Medicaid? Eligibility for Humana Medicaid depends on state specific criteria, including income, residency, age, disability status, and family size. Check with your state's Medicaid office or Humana's website for specific eligibility requirements. Let's move to question number 3. How do I enroll in Humana Medicaid? You can enroll in Humana Medicaid through your state's Medicaid office during the open enrollment period or when you first become eligible. Some states allow online enrollment while others require paper applications or in-person visits. So this is the answer for question number 3. Now let's move to question number 4. What services are covered under Humana Medicaid? Humana Medicaid typically covers a variety of services including doctor visits, hospital stays, emergency care, prescription drugs, preventive care, for example, immunization, screening, mental health services, vision and dental care, varies by states, maternity and newborn care. Now, question number 5. Are prescription drugs covered by Humana Medicaid? Yes, the answer to this question is yes. Prescription drugs are generally covered. However, the specific drug covered may vary based on the state's Medicaid formulary and Humana's plan. Check the formulary list provided by Humana for details. Number 6. Now, question number 6. Do I need a referral to see a specialist? Now, the answer to this question is depending on your Humana Medicaid plan. You may need a referral from your primary care provider, which is also called as PCP, to see a specialist. Check your plan details and or contact Humana customer service for specific information. Now, question number 7. How often do I need to renew my Medicaid coverage? Medicaid coverage typically needs to be renewed annually, but the exact frequency can vary by state. You will receive a renewal notice from your state's Medicaid office with instructions. So let's move to question number 8. What documents do I need to renew my Humana Medicaid coverage? You will generally need to provide proof of income, residency, and any changes in household size or employment status. Specific documents can include pay stubs, tax returns, utility bills, and identification. Now, question number 9. How do I renew my Humana Medicaid coverage? Renewal can usually be done online through your state's Medicaid portal by mail or in person at your local Medicaid office. Follow the instructions provided in your renewal notice. Okay, now let's move to question number 10. How do I find a doctor that accepts Humana Medicaid? You can find doctors and other healthcare providers that accept Humana Medicaid by using the provider directory on Humana's website or contacting Humana customer services, guys. So let's move to question number 11. What should I do if I lose my Humana Medicaid card? If you lose your Humana Medicaid card, contact Humana customer service immediately to request a replacement card. Question number 12. How can I check the status of a claim? You can check the status of your claims by logging into your Humana member portal, contacting Humana customer service, or reviewing your explanation of benefits, which is also called as EOB. Okay, so benefit statements, EOB statements. Now, question number 13. How can I contact Humana Medicaid customer service? You can contact Humana Medicaid customer service via phone, email, or through the member portal on Humana's website. The contact details are usually provided on your member iCard and Humana website, guys. Question number 14. What if I have a complaint or need to file an appeal? If you have a complaint or need to file an appeal regarding your coverage or services, you can contact Humana customer service for guidance on the process. There are specific procedure and timelines for filling appeals, which are detailed in your plan documents. Now, question number 15. Where can I find more information about my Humana Medicaid benefits? You can find detailed information about your benefits in the member handbook provided by Humana on their website or by contacting customer service. The member handbook includes comprehensive details about coverage, benefits, rights, and responsibilities. These frequently asked questions cover some of the most common regarding Humana Medicaid. For personalized assistance, always refer to your plan documents or contact Humana customer service directly. Now, solutions to common issues that members might encounter, such as denied claims or difficulty finding providers. Navigating Medicaid coverage with Humana can sometimes present challenges, such as denied claims or difficulty finding providers. Here are solutions to common issues that members might encounter. Denied claims. Number one, understand the reason for denial. Explanation of benefits, which is also called as EOB. Review the EOB statement from Humana to understand why the claim was denied. Common reasons include missing information, non-covered services, or lack of pre-authorization. Contact customer service. If the EOB isn't clear, contact Humana customer service for a detailed explanation. Number two, correct and resubmit the claim. Correct errors. Identify and correct any errors in the claim, such as incorrect billing codes or missing information. Resubmit. Follow the instruction provided by Humana to resubmit the corrected claim. Ensure all necessary documentation is included. Number three, file an appeal. Gather documentation. Collect all relevant documents, including medical records, referral letters, and the original claim submission. Submit an appeal. Write a detailed appeal letter explaining why the claim should be covered and submit it along with the supporting documents to Humana. Follow the appeal process outlined in your member handbook or on Humana website. Number four, seek assistance. Healthcare provider. Sometimes the healthcare provider can assist in resolving claim issues or provide additional information required by Humana. Medicaid office. If you encounter persistence issues, contact your state Medicaid office for additional support and guidance. Solutions to common issues that members might encounter, such as denied claims, or difficulty finding providers. Now, difficulty finding providers, number one, use Humana's provider directory. Online directory, access Humana's online provider directory to find in-network doctors, specialists, hospitals, and other healthcare providers. Updated information. Ensure you have the most recent directory as provider networks can change. Number two, contact customer service. Assistance. Humana customer service can help you find providers who accept your Medicaid plan. They can also verify if a specific provider is in network. Recommendations. Customer service can provide recommendations for providers based on your location and healthcare needs. Number three, check with healthcare providers directly. Verification. Before scheduling an appointment, call the healthcare provider's office to confirm they accept Humana Medicaid and are accepting new patients. Referrals. If your preferred provider is not in network, ask if they can recommend a provider who is. Number four, explore additional resources. State Medicaid office. Your state Medicaid office can provide a list of Medicaid approved providers in your area, guys. Community health centers. Now, federally qualified health centers, which is also called as FQHCS, okay? FQHCs and community health clinic often accept Medicaid and provide a range of services. Now, solutions to common issues that members might encounter, such as denied claim or difficulty finding providers. We are on prescription issues. Let's understand prescription issues. Number one, verify coverage. Formulary check. Use Humana's formulary list to verify if your prescription is covered. Some medications might require prior authorization or be subject to quantity limits. Alternative medication. If your medication is not covered, ask your healthcare provider if there is a suitable alternative that is on the formulary. Number two, obtain prior authorization. Process. Work with your healthcare provider to submit a prior authorization request if required. Ensure all necessary medical justification is included. Follow up. Regularly follow up with Humana and your provider to check the status of the authorization request. Number three, appeal denials. Documentation. Gather all relevant medical information and submit an appeal to Humana if a prescription is denied. Provider support. Your healthcare provider can often provide additional support and documentation to strengthen your appeal. Now, general tips. Number one, keep accurate records. Documentation. Maintain copies of all communications, submitted forms, EOB statements, and any correspondence with Humana. Timelines. Timelines. Pay attention to deadlines for submitting claims, appeals, and renewals to avoid delays or lapses in coverage. Number two, stay informed. Plan documents. Regularly reviewing your plan documents and member handbooks to stay informed about your coverage, benefits, and procedures. Updates. Watch for any updates or changes to your Medicaid plan from Humana which may affect your coverage or provider network. Number three, utilize online tools. Member portal. Use Humana member portal to manage your account, track claims, find provider, and access important information. Mobile app. Download the Humana mobile app if available for convenient access to your benefit and services on the go. By staying proactive, informed, and organized, you can effectively manage common issues and ensure you continue to receive the healthcare services you need through Humana Medicaid. Now, contact Humana or their state Medicare office for unresolved issues. For unresolved issues with your Humana Medicaid coverage, contacting Humana directly or reaching out to your state Medicaid office can provide the assistance you need. Here is how you can effectively contact both Humana and your state Medicaid office. Contacting Humana. Number one, customer service phone number. Medicare customer service. Call the Humana Medicaid customer service number listed on your member ID card or on Humana's website. This number is typically dedicated to Medicaid members and can assist with a wide range of issues. Number two, online member portal. Access and manage your account. Log into Humana's member portal to manage your account, check claim status, update personal information, and contact customer services through secure messaging. Number three, email and chat support. Email support. Use the email support option available on Humana's website to send inquiries and receive responses from customer support. Customer services. Live chat. Some issues can be resolved via live chat at Humana's website, offering a quick and convenient way to get assistance. Number four, mailing address. Send documents. If you need to send documents or written communications, use the mailing addresses provided on your EOB statements or the Humana website. Now, contacting the state Medicaid office. Number one, Medicaid office phone number. State specific assistance. Call your state Medicaid office. Each state has a dedicated phone number for Medicaid inquiries. You can find this number on your state's Medicaid website or in your enrollment materials. Number two, state Medicaid website. Online services. Visit your state Medicaid website for information on benefits, eligibility, renewal processes, and contact details. Many states offer online portals where you can manage your account and communicate with Medicaid representatives. Number three, local Medicaid office. Local Medicaid offices. In-person visits. For more personalized assistance, visit your local Medicaid office. You can find the nearest office location on your state's Medicaid website. Number four, email and mailing address. Written correspondence. If you prefer to communicate in writing, use the email or mailing address provided by your state Medicaid office. Be sure to include your Medicaid ID number and any relevant details to help them assist you effectively. Now, steps to take when contacting Humana or state Medicaid office. Number one, prepare information. Personal information. Have your Medicaid ID number, Humana member ID, and any relevant personal information ready. Documentation. Gather all necessary documentation related to your issues such as EOB statements, denial letters, prior communications, and any supporting documents. Number two, explain the issue clearly. Detailed description. Provide a clear and detailed explanation of the issue you are experiencing, including any steps you have already taken to resolve it. Ask specific questions. Be specific about what you need help with, whether it is a claim denial, finding a provider, or understanding your benefits. Number three, follow up. Record conversations. Take notes during your call or keep copies of emails and letters. Record the dates, the name of the representative, and the reference number of your inquiry if provided. Confirm receipt. If you send documents or written communications, confirm that they have been received and ask for a timeline or when you can expect a resolution.
So guys, that's all about this video tutorial. I hope that you found this video useful, and if you enjoyed watching this video, then don't forget to hit that like, subscribe the channel and click that notification bell so that you don't miss out on any update. All right, so thank you for watching and see you next time. Bye bye.